Morning, everybody, and welcome. I see there's quite a lot of people online today. Welcome to Sanocare Breath of Hope presentation this morning. I get to introduce my friend and colleague, Dr. Emmanuel Taban. He always complains about his bio being too long, but there's a few things I feel need to be said. So Dr. Taban is a South African pulmonologist. He has a lot of expertise in many pulmonary, complex pulmonary diseases. During the COVID-19 pandemic, Dr. Taban applied therapeutic bronchoscopy to remove mucus plugs in critically ill patients, contributing to improved outcomes in selected cases. He has been recognized for his medical contributions, including being named one of the 100 most influential Africans of 2020 by New African magazine. He's also the author of his autobiography, The Boy Who Never Gave Up, and established the Emmanuel Taban Foundation, which focuses on education and skills development for young people in Africa. And this platform is also a demonstration of his passion for education. We are very lucky to have you do this presentation today.
Good morning. Thank you, Bian, for the kind introduction. Today, the topic is loud and clear. So the title of the topic is called "Calling Vaping Safer Than Smoking is like saying the devil looks better in skinny jeans." And this really, I think, the photo is well illustrated. Look at a few things. The old devil, old problems. New devil, same problems. Okay, and that's really, I think, is a launch in heaven or in hell. Not so sure, depends what you believe in. But the point of this presentation is really to highlight quite a few things. One is to look at the number one, the burden of the disease. Two, why people smoke. Three, what are the factors that attract people to smoke. Four, to compare cigarettes against vaping. And lastly, we look at actually conditions that are made worse with this with underlying vaping. And lastly, we look at regulation in South Africa, which is currently under development, but maybe I could highlight that and also look at European regulation of e-cigarettes or vaping. Let's start. It's going to be a long presentation, but hold on. So the global burden of smoking and vaping, tobacco use, and the rise of e-cigarettes represent one of the biggest public health threats the world has ever faced. This infographic explores the staggering health, economic, and social costs associated with these habits. There are about 8 million globally killed every year because of the vaping and smoking. Annual deaths worldwide directly attributed to tobacco use. Overall, 1.2 million of those deaths are the results of non-smokers being exposed to secondhand smoking. Nicotine trap. I think this is probably a very important concept. How early starts lead to lifelong struggle for today's youth. 37 million global youth tobacco users, and estimated 7 million young people aged 13 to 15 use some form of tobacco globally, with e-cigarette or what we call vaping become the primary gateway to nicotine addiction. The modern getaway, product preference. While traditional cigarettes use among youth has hit historic low, new nicotine products led by e-cigarettes or what we call vaping dominate the landscape. This chart showcase the most commonly used product among middle and high school students, highlight the shift in consumption pattern. So if you look, vaping account for about 58% of all cigarettes, overtaking all form of smoking, followed by nicotine patches, where now actually we're using for quitting, now become the second use product. Cigarettes has dropped to number 3, cigars to number 4, and of course the smokeless tobacco. Then why do we start? And this photo says so much about itself. This is how young people dancing, celebrated. Let's see what the statistics say. Why do we start smoking? The path to initiation. The journey into nicotine use is really a single choice, but the results of multiple converging influences. social pressure, pervasive marketing, appealing product design create a powerful panel that draws young people in. Now, if you look at the influence panel, social and peer influence, seeing friends and family using product is a primary biggest trigger for young people to start smoking. Appealing flavors, fruits, candy, and mint flavors mask harshness and attract young people. And lastly, marketing and media, exposure to arts and social media content normalize usage. And this helps young people initiate nicotine smoking. So if you look at top reports reason for first smokers, the first is a friend used them. It's number one reason. Second, curiosity, because you're seeing other people use them. Thirdly, a feeling flavor because it tastes nice. I like mango. I like mint flavor. And lastly, family member use them. So again, family members can be a wrong model to the young people or young mind. The question that for us to understand it, we need to go back to understand the pathophysiology of nicotine while this young mind get attracted to nicotine. So I need to discuss about nicotine which is really a common denominator in vaping and also in smoking cigarettes. So I need to look at the mechanism of actions, systemic effect, and references. So overview, the primary target, of course, of the nicotine and neuron and non-neural nicotinic acetylcholine receptors. And of course, rapid CNS entry, reinforced tolerance and dependence. Systemic effects, you get autonomic, cardiovascular, immune modulation, and cancer promotions. Metabolic, of course, we look at the enzymes of CYP2A6, which give you the nicotine, genetic variation effects, and dependence. Now, let's quickly have a look at the acetylcholine receptor structure and signal. It's a pentameric ligand gate caution channels. You got A and B subunits. A units are you got A4, B2, and A7, A3, B4, and A6. Activation is going to lead to the sodium calcium influx, deferrization, and neurotransmitter release. Please.
I'm sorry, I forgot I was supposed to just remind everybody online to please mute their microphones so we don't have interference, please.
So A7 is a high calcium permeability implicated in immune signals and cancer pathway. Chronic nicotines lead to desensitization and paradoxical upregulation. Now, if you look here, this is really nicotine. So you find all this effect because from whether you vaping or whether you smoking cigarettes, the action remains the same. Pharmacokinetic and metabolism, routes, inhalations, rapid brain delivery, oral and transdermal. Nicotine's about a half-life of 2 to 3 hours, and continine is about half hours, 15 to 16 hours. Many metabolic enzymes as CYP2A6, nicotine metabolic ratio reflects activities. Genetic CYP2 and A6 pattern modifies smoking intensity and sensation success. Smoking as a deadly habit. Smoking is a primary cause of many of the world death list disease. This chart illustrates percentage of all deaths from those conditions that are caused by tobacco, lung cancer, COPD, and respiratory illnesses like pulmonology, heart failure, stroke, and other cancers. What about the young brain? Teenagers, what happened? The brain under development is unique vulnerable to smoking. The adolescent brain continues to develop until the age of 25. Nicotine exposure during this critically period, can disrupt brain circuit formation, leading to lasting consequences. Harm to brain circuits, impact part of the brain controlling attention, learning, and impulse control. Mood and mental health can worsen symptoms of anxiety and depression, creating a cycle of self-medication and suicidal attempts. Increased addiction risk frames the brain for higher risk of addiction to nicotine and other substances later in life. And that's really, I think, the biggest problem with the smoking. CNS reward tolerance withdrawal, nicotine activate VAT dopamine neurons, and that lead to increased dopamine in nuclear accumbens or reward center. synaptic glutamine facilitation plus gamma aminobutyric acid lead to desensitization, lead to net excitation. And of course, you get receptor plasticity, where there's upregulation, desensitization, underlying tolerance and dependence. And that's why those young minds become addicted to this nicotine. Withdrawal, of course, you get the negative effect. Once you withdraw, you get negative effect, hyperexcitability, and also in interpendicular circuits. Autonomic and cardiovascular effect, of course, N-acetylcholine in autonomic ganglion and adrenal medulla lead to catecholaminergic surge. And in cardiovascular, you got increase in heart rate, increase in blood pressure, vasoconstriction, and then chronic endothelial dysfunction and prothrombotic state. Renal contribute to atherosclerosis, insulin resistant, atherogenic risk. And all of them risk myocardial infarction, risk of strokes, and obviously a lot of other shorten your lives dramatically. So what about the immune modulation effects of an inflammation in nicotines? Of course, you get 1-alpha N-acetylcholine activation dampen in the nuclear kappa B, which is our inflammatory driver and pro-inflammatory cytokine. So that's TNF, interleukin-1 beta, and IL-6. Progenics, an anti-inflammatory pathway, which is vagus-mediated modulation of macrophage. And then you get context dependent, can impair host defense or reduce harmful inflammations. Cancer biology and nitro amines. N-acetylcholine on epithelial cancer cells activate P13K2 and AKT, and the prone little proliferation and survival of cancer cells. And nicotine promotes also angiogenesis. As the results, you got rapid growth of cancer cells, metastasis, and also resistant to chemotherapy. And tobacco-specific nitrous amines are potent carcinogenic and metabolic activation form of DNA addicts. Special population development and pregnancy. What happened to nicotine in pregnancy? Nicotine cross placenta and affect fetal brain development. So mothers that smoke during pregnancy or get exposed to vaping during pregnancy, unfortunately, does affect the child development and their brain and their function later in life. Prenatal exposure, alter neuroproliferation, migration, and long-term neurobehavior risk. Most of these children tend to have a lot of the neuropsychiatric problems. Young and adolescent exposure lead to greater addiction vulnerability due to matured cycle. Clinical and therapeutic implications, of course, nicotine replacement therapy reduce withdrawal but deliver nicotine systematically. Non-nicotine pharmacotherapies, of course, you have in drugs such as bupropion, target N-acetylcholine signal and dopamine receptor system. Then consider cardiovascular risk in prescribed NRT to higher risk patients. And we just know that these nicotine patches, sometimes what they do, they've been abused by young people who even doesn't smoke, so that because they wanted to, the effect of nicotine. Of course, there's ongoing research about selective acetylcholine modulators, immunomodulator effect in cancer interactions. Nicotine delivery. Nicotine are delivered in two ways currently, in cigarettes and in vaping. In cigarettes, of course, you got rapid nicotine spike in bloodstream after just smoking one puff. Immediately within seconds, it's in the bloodstream, and a strong reinforcement of addictions. In vaping, it's much more gradual. More gradual nicotine absorption, depends on device type, can be tailored to lower nicotine levels. So tobacco smoking is the leading cause of preventable disease worldwide, and vaping, of course, as emerged as a potential alternative, but benefit and risk remain debatable. And that leads us to our topics. It says everything. So what are the type of vaping devices? There are quite a few of them. You have in the past, you have the cigar likes, which came onto the market in 2007 already. Most deliver nicotine and was disposable. And then you have in the vape pens, these ones, the vape pens, of course, which is has a refillable e-liquid cartridge, allows users to regulate the frequency of inhalations. And then the port system, of course, use USB sharp ports has higher amount of nicotine than previous generations. And then you have disposable pipes, like pen has a certain amount of on pools available, then it has to be thrown away. And then the last one, this for the really addicts, is the box mods, larger in size. E-cigarettes allow more aerosol nicotine other than chemicals to be breathed in at a faster rate. Now, these are the generations. First generation has unique user and disposable. And then second generation refill cartridge, replaceable battery. And third generation refillable cartridge, customization of subsets, adjusted voltage and wattage. And also it's rechargeable. So when you sleep at night, you can charge in the morning. When your addicts come at 3, 5 o'clock, then you're up to it again. And then, of course, fourth generation, extremely longer charge time, variation in size, shapes, and colors, adjustable airflow and temperature sensing. What are composition difference? Of course, you have on the top, you have your e-liquid components, and then flavoring, nicotine, glycerin, and propyl glycerin. And then conventional cigarettes, of course, what you have the tobacco composition, produce about 7,000 chemicals, 70 plus carcinogen, means cancer-driven kind of chemicals. And vaping, e-cigarette typically contain nicotine, propylene, glycerol, vegetable glycerin, and flavoring, lower number of toxins compared to smoke. Common e-cigarette liquid ingredients, of course, base solvents are propylene, glycerol, and vegetable glycerin, aerosols, carriers. Active would be a nicotine, a pre-base or nicotine salts, and variable concentration. Flavoring, hundreds of compounds that are actually involved in flavoring. Unfortunately, that the market is not well regulated, and you can get a very harmful chemicals inside it. Containments and adulterants are your metals, such nickel, lead, and of course your vitamin E acid. Somebody common e-cigarettes, of course, that would be your base solvent, propyl glycerol, and vegetables. Active would be a nicotines, and flavoring would be hundreds of compounds, of course, and then not forgetting the metals such e-cigarette. And if you look at all these products, that you can develop some form of respiratory problems from bronchiolitis to asthma. But of course, we are in the era where the e-cigarettes, the new baby on the horizon. So most of the time, I think as time goes on, more effect come to play. So what are the reported side effects and the systemic risk of e-cigarettes? Of course, you've got your metabolic, where you get a potential insulin resistant, alter liquid profile, imaging evidence that most of the people with using e-cigarette can actually later develop diabetic. Acute, they get throat irritation, cough, chest pain, dyspnea, nausea, and vomiting. And of course, cardiovascular, they have increased heart rate, BP, endothelial dysfunction, thrombotic changes, and of course, rates of heart attack increases. And then neurological and psych, nicotine dependence, mood change, impair adolescent brain and development, and that leads to the risk of suicidal. Let's look at the e-cigarette, EVAL-I, which is a part of lung injury, or what we call vaping as e-cigarette or vaping associated lung injury. So outbreak in 2019 linked to illicit tetrahydrocarbonate products with vitamin E acetate levels presented. Those children, I think, was children that smoked them, and then they have subacute dyspnea, cough, hypoxemia, GI symptoms. CT scan, they got a bilateral ground glass opacity. In pathology, when they did that, some of the children actually died. There was a lipid-laden macrophage reported. Histology saw diffuse alveolar damage, organizing pneumonia and pneumonitis, and those children were in ICU for a while, and most of them actually died. So because of the chemicals that was found on the e-cigarettes. Mechanism, chemical injuries, surfactant disruption, inflammatory response to the particles. So mechanism of lung injury, of course, in patients that smoke e-cigarettes, you get aerosolized constituents, nicotine, and then you have your flavorings and metal. And then that leads to the chemical reaction on heating, thermal decomposition, and then lead to aldehyde, generation of the reactive carbon species, which are very toxic to the lung, and lipid carrier. And then device factor also play a role, high temperature, cold materials, contaminants, and poor quality of disposal is very important where they are made. Particle deposition and deep lung delivery, ultra fine particles, higher deep lung penetration, and also the inactive lipid deposition. The problem that the results of that lead to the cellular effect, epithelial injury, and increase permeability, macrophage uptake, and that leads to the lipid macrophage.
Sorry, somebody's microphone is on. If I please can mute it.
And then oxidative stress, mitochondrial dysfunction, impaired mucociliary clearance. That's why they tend to cough with a lot of mucus in the lungs. They can't breathe at night, and because of the e-cigarette. Inflammation and pathology, and where you have neutrophilic inflammation, diffuse alveolar damage, organizing pneumonia, and lymphoid pneumonia, hypoxic respiratory failure. Most of these patients, people present with GPs, they have this pneumonia, they get antibiotic, but never improve. And the risk of death was quite very high. What about the health effect in short term? Of course, cigarettes, immediately cardiovascular strain, oxidative stress, carbon monoxide exposure. Vaping reduce exposure to tar and carbon monoxide and still associated with the higher irritation, inflammation, and epithelial dysfunction. Potential benefit of vaping, of course, is harm reduction. Current smokers use as a smoking cessation. Again, we do, as a pulmonologist, we do recommend e-cigarette for 6 to 1 year for people to quit. But after 1 year, there's no benefits. So we don't promote it for people to use to switch to e-cigarette. No, only as a mode for sensation. Please, clearly, when the doctor, pulmonologist say you can use e-cigarette for 6 to 12 months because we wanted you to quit, because the smoking cigarette is much more dangerous than e-cigarette. But that does not say that e-cigarette is safer. It's just a devil on the skinny jeans. That's all to it. Concern, youth uptake and get away to smoke, a non-long-term safety profile, regulation education are essential. So choose your poison wisely or not. This is very important. Addiction potential, both methods deliver nicotine, a highly addictive substance. So the addiction remains the same whether you smoke cigarettes or vaping. Cigarettes, well-documented addiction and withdrawal. Vaping, nicotine salts in powders, devices can lead to equal or high addiction rate among young people. So think about your young generations. Health effect long-term, proven cause of lung cancer, COPD, heart disease, stroke. Vaping, long-term data is still limited. We don't have it. Emerging evidence of risk, which you have e-cigarette and vaping, associated lung injury, possible cancer-related because of aldehyde exposure, and vascular effect, risk of heart attacks also increase with vaping. Cancer risk, cigarettes strongly linked to lungs, oral, esophageal, and bladder cancer. Vaping, lower carcinogenic exposure, but aldehyde and nitroamines detected in aerosols. Current evidence suggests lower cancer risk than smoke, but not risk-free. Vaping besides conventional cigarettes, a deep research based on comparative analysis. Okay, so cigarettes, major cause of COPD, emphysema, and chronic bronchitis. Vaping, e-cigarettes exposure impaired endothelial barrier, mucociliary clearance, and macrophage function. In vitro and animal studies show reduced phagocytosis, altered neutrophil response, increased susceptibility to bacterial or viral infection. Risk of lymphoid pneumonia. Lymphoid pneumonia is when your lungs, the oil that you inhale from the e-cigarettes, kind of get absorbed in the lung and the lung cannot digest it. Then you have white patches on your lungs. And then clinically associated with increased bronchitis symptoms, higher risk of respiratory infection, adults and young people. So, and that increases the cost of medical aid. COPD and vaping, of course, just to have a look, this is how the lung look like, and look how horrible they look. So vaping and COPD, part of physiology. Now, if you read this or got the COPD or emphysema, e-cigarette aerosols contain nicotine, volatile organic compound, metal, and flavoring. Inhalation triggers airway inflammation, oxidative stress, and epithelia. That's why most of my patients, when I say use e-cigarette to quit smoking, the following week they come to me that, doctor, I'm coughing so much, I don't like it. Unfortunately, because of those chemicals that trigger that cough. So then the best is we switch you to patch, okay? Or we have to psychologically, you have to quit or other tablet. Similar mechanisms to smokers through potential less carbon monoxide exposure. Animal studies show emphysema change with long-term exposure. So basically, e-cigarette can cause emphysema in long-term also. But we need more data. Potential benefit compared to smoke, reduce exposure to tar and combustion products. Some COPD patients report symptom relief after switching and lower levels of carbon monoxide in bloods, and also may support smoking cessation in selected cases. Again, as I say, some people can use it for quitting smoking. Some people, they cough like crazy. It doesn't help them. So we have to choose our battle carefully. Again, you must listen to your patients. If those who cough from it, don't suggest that to them. Use patches. We having other modalities where we can use for them to quit smoking. Adverse effect of vaping in COPD, of course, increased airway hyperactivity, oxidative stress lead to progressive lung damage, impaired mucociliary clearance, means you cannot get out mucus. Most of the time they cough, they feel like they have mucus in the lung, but it can't come out. Okay, and high risk of acute exacerbation. Most of the patients that use e-cigarette, they tend to come with frequent exacerbation, a lot of recurrent viruses, because the mucus remain thick in the lung, and when we inhale all these viruses, then they tend to cause infection. And then, of course, not to forget, they are associated with the lung injury. Risk of infection, vaping impair innate immune system. Innate immune system means your lining of your respiratory system is get damaged from the e-cigarettes. Studies show high susceptibility to bacterial pneumonia because we inhale so many bacteria in the lung is supposed to get rid of them through the help of the innate immune system. However, when you're vaping, of course, you're unable to get rid of those bacteria, then they get pneumonia. So statistically, actually, we don't have our own data in South Africa, but if you look at the amount of people coming, most of my patients come with a lung problem because they're vaping. Amazing, they come almost every 6 weeks with the same problem. You treat and that's why most of people get exposed to different antibiotics, then they get antibiotic resistance and the increased risk of mortality. And we actually probably one of the countries that spend billions of money on antimicrobial therapy because of that behavior that our patients actually expose themselves to. And then, of course, the risk of infection would be a viral infection from influenza, metapneumonia virus, your rhinovirus may worsen in COPD papers. Effect of vaping on brain development, of course, I did mention about that already. And then let's look at asthma. What about those who are asthmatics? Now, if you're asthmatics, asthma is a chronic inflammatory airway disease. Vaping exposes the lungs to aerosols, nicotine, flavorings, and volatile chemicals. Increased evidence links e-cigarette use to asthma onset, exacerbation, and poor disease control. So now people who doesn't know that they have asthmatic, they would be having more chance of being diagnosed as asthmatic just after they're using e-cigarettes. Or those who already with well-diagnosed asthma, the asthma become uncontrolled. So again, e-cigarettes for asthmatic is no-go area. The risk of sudden death are very high. We're seeing young people at the age of 16, 18, they have this horrible asthma attack and then they die at home or even when being rushed to the hospital. So it's very, very important that you have to talk to your children carefully, especially those who are asthmatic or underlying lung problems, not to smoke e-cigarette because the risk of the sudden death are high for you to lose your young one. So as a doctors in the community, we should be able to promoting all those evidence-based facts about smoking. Vaping also expose increased evidence link e-cigarette use to asthma onset, exacerbation, and poor disease. Pathophysiological mechanism, airway inflammations, aerosol trigger epithelial and macrophage activations, oxidative stress, of course, you get nicotine, aldehyde, and heavy metal cause reactive oxygen species productions. Airway hyperresponsiveness, nicotine stimulate vehicles pathway, and mucosal hypersecretion impact ciliary clearance and increase susceptibility to viral and bacterial infections. Research evidence across adults using e-cigarettes have higher rates of asthmatic symptoms. This was already in 2017. And then cross-sectional studies link vaping to chronic cough, wheeze, and bronchitis. Animal models saw airway remodeling and eosinophilic inflammation after e-cigarette exposure. And eval cases highlight severe inflammation lung injury. Clinical implication, vaping is not safe for asthmatic, despite being marked as a safer alternative. Worsening asthma control and may increase hospitalizations. Sensation counseling should be included in asthma management, and long-term risk is still under investigation. In conclusion, of course, vaping is likely less harmful than conventional smoking, but it's not harmless. Should be considered only as a harm reduction strategy for smokers, not for young or non-smokers. Again, it's not for young people. It only can be used as a tool for people to quit smoking. More longitudinal studies are needed to fulfill understanding the long-term consequences. Now, let's look at vaping in South Africa. What did the regulation actually say? The regulatory landscape was set in September 2025. As of September 2025, South African approach to vaping is in state of transition. While current laws are limited, a comprehensive new bill proposed as much stricter features. This guide breaks down what is law today, what's on the horizon, what's meant for you. The rules today, a mixed bag. The big number, of course, excise duty of 2.9 rand per liter. A national excise tax, milliliter, sorry. A national excise tax applied to all the vaping liquids, both nicotine and non-nicotine. Importers and manufacturers must register with SARS and pay this duty. So it means the cost is going to be expensive, which is perhaps a good thing. Current regulatory pillars of regulation today isn't one single law, but combination of tax policy, voluntary standards, and existing Medicine Act. Tax law, the primary enforcement mechanism, targets the product liquid directly. And SBS standards, voluntary SANA, provide a safety benchmark for products, and Medicine Act apply only if a product makes therapeutic or health claims. And then the SABS standards, of course, while voluntary, this standard sets key safety guidelines. It suggests a maximum nicotine concentration, provide a benchmark for consumer safety compared to other regulatory products. The future on the horizon, the new bill, of course, the Tobacco Products and Electronic Delivery System Control Bill currently before Parliament proposes a radical shift. It aims to regulate vaping strictly as smoking. Indoor use means currently no national ban, but policy set by venue. So they're going to propose 100% vaping free indoors, public places by law. Sales to minor, currently no national law banning the sales to under 18. So there'll be a proposed formal ban on all sales to individuals under age of 18. That's coming. Advertising, currently point of sale displays are common. Proposed, there will be ban of all point of sale displays and vending machines. So I'm waiting for those. The biggest visual changes, of course, the plain package. The bill mandates plain, standardized package with larger graphic health warning, removal old branding and appealing designs. Today's package is Vape Wave, Tropic Mango, Nicotine 35. And proposed plain package will be, of course, will be health warning and vaping wave, Tropic Mango. Will not, which is, I think, look cool. Compliance and action guides, of course, for sellers, importers, and manufacturers. Register for exercise. You must register with SARS and comply with all payments and record keeping duties for 2.9 milliliter tax. Aligned with of course, SANS, adopt the voluntary standard for product safety, labels, and child-resistant closure. This is your best practice baseline. For premise managers, of course, workplace more, set your own policies. You currently have the right to implement and enforce web-free policy on your premise through internal rules, signatures, and contracts. This proactive step aligns with the direction of pending national bills. Avoid therapeutic claims. Do not make health or smoking cessation claim unless your products register with SAFRA. So basically, what does that mean to schools? Because most of the young people in the schools, they're smoking. So the school governing body actually can change. They can implement rules within their school that there will be vaping free or smoking free within the school campus. And that's they can do it because I think the new law letter will support them. So I think every school governing bodies, they have the right to implement that. The key gray areas to watch until the new bill passed, several areas of regulation remain ambiguous. Businesses and consumers should monitor this topic closely for future change. Indoor vaping rules. Policies vary by venue, creating a confusion. The new bill will standardize this. Advertising and online sale, vaping Pacific national and rules are pending. General Consumers Protection Law apply for them. Flavoring and packaging, no national limits on flavoring exist yet. The new bill is expected to introduce a major restriction. Navigating the hash, a visual guide to vaping regulation in European Union. Let's see what the Europeans are doing. The European Tobacco Products Directive set baseline rule for all member states, but countries can and do implement strict national rules. This creates a dual layer regulatory system. 20 milligram per ml maximum nicotine concentration allowed in all liquids. 10 mL maximum volume for single e-liquid refilling container. 2 ml maximum capacity for vaping tanks, cartridge, and of course powders, which is quite good. Our regulation flows, EU levels, of course, for tobacco product directives, set the minimum standard for safety and quality, and the member state levels are national laws, can add stricter rules on flavors, tax, and public use, but not to increase on those. And patch work of national laws beyond the tobacco product directive, the vaping experience varies dramatically across EU due to diverse national policy on the key issues like flavoring and public consumption. And then if you look at the national stance on e-liquid flavoring, many EU members are moving to stricter or ban e-liquid flavors other than tobacco to curb youth appeal, but approaches are not uniform. So the biggest, of course, would be banning would be most Netherlands, followed by France, Latvia, Germany, and Italy, and Spain. They're quite more, they're still permitted. Regulation of vaping in public spaces. Over half of the countries in the World Health Organization European region have national level legislation restrict e-cigarette use in certain public areas. And that's already cuts a good step forward. And the crackdown on disposable, citing environmental waste and surge in youth uptake, several European nations are taking definitive action by banning single-use vaping products. January 1, 2025, Belgium became one of the first European countries to officially ban the sale of disposable e-cigarettes. February 2025, France banned all disposable vaping or puffs. Is expected to come into effect pending final approval. June 1, while outside the EU, the UK banned all the single-use vaping marks as a major trend among European nations. And ongoing other European nations, include Ireland and Germany, are actively considering similar restriction on disposable products. Road ahead, what's next for EU vaping rules? The regulatory landscape remains dynamic with a significant potential change on the horizons. So, Tobacco Access Directive revision, the EU is considering reverse that would likely introduce a harmonized EU-wide minimum excess tax on vaping products. This could significantly increase price in member states with current low or no specific tax on e-liquids. Future, of course, the Tobacco Product Directive itself is subject to to predict reviews, future update could introduce even a stricter regulation on flavoring, packaging, and advertising rules for further alignment them with traditional tobacco control. Thank you. That's all. The choice is yours.
Thank you so much. That was a really excellent presentation. I think in South African schools, it is a real problem. I mean, I was listening to the radio the other day and they were saying that the kids are buying vapes left, right, and center, using them in the schools, and South African law is a bit behind. I see we have a lot of people online. Are there any comments or questions from the people on there?
Any questions? Hello? Any question out there? Yeah, so I think with the schooling, I think the question that have, because I think we have seen a lot of children that has come really with the acute asthma, and of course, most children will not disclose that they're actually vaping. And you actually seen the trend in the last few years. I think the last 2 years, I've seen a lot of young children that between age of 12 to 17 that really come with the asthma that are difficult to control. You spend and you actually teach them how to use their inhalers very well. And most of them really could be attributed to the vaping that is really quite, I would say, endemic in South Africa. That most schools actually, they are so much of them, they got no restriction, the governing bodies, of course, they even the teacher themselves, some of the teachers are vaping, of course, and the governing body does not really have a strong, strict rule on the school premises that actually prevent those children actually from vaping. So I mean, as I say, for as a pulmonologist, yes, we do agree that for quitting is okay for 6 months to a year. That's quite based on the European and American guidelines and also Southern guidelines. But it's really we don't promote vaping as safer than the smoking. I think if we have a way, both can be actually prohibited or prevented. That you have to find something else to do. But I think not vaping, only the smoking.
Ask you something. There's something that I don't really understand about the vaping as a tool for cessation, because logic tells me that if you are a smoker, previously you had to find a smoking area to smoke in, and now if you switch to a vape, you can pretty much vape anywhere. So are you not at risk of actually using more nicotine when you switch over to the vaping device and worsening your addiction? Or is it because when you're smoking cigarette, within seconds it's in your systemic circulation, your nicotine effect is there, and it's more slow release with the vape that you're getting rid of that kind of physical, psychological addiction?
I think, yeah, you're right, Leanne, because initially the thinking was that if you use vaping, because it's slow release, it's gradual, you don't have that withdrawal or dependency effect very quickly. Yes. But of course, now what I've seen with most of my patients, they actually now, because there's so much become more addicted because they use the cigarettes, and when they in the plane, they're vaping or in the public places because it's more acceptable. So now it becomes like two-edged sword, where they now kind of going to much more addiction, actually.
I think there's maybe also, perhaps, I'm not sure exactly how true it is, but a kind of false sense of control, because now you can control your nicotine content that you're telling yourself you're reducing, but actually you're actually using more than, I mean, I see that with my dad. He vapes. And I think he's got a vape in his hand 24/7.
You see, it's a habit, because you kind of.
It's not.
The problem, I think, vaping is just like a phone, because you always carry a phone. Yes. Become addictive, and that's the issue. Because do people addicted to the phone? The answer is yes. The same as vaping, you also get addicted to it because every time quickly, and because there's no restriction. Yes. Unless we put restriction in places. That's also vaping should be treated like cigarettes. Make sure that you can't do it in the public places. Yeah. No, I think absolutely spot on there. All right. Since there's no question, we're going to call the meeting off and say thank you guys for joining. It's been amazing. And I hope you guys have a lot of information.
Oh, this question. Next question.
Yes.
Hello.
Yes, I'm listening.
Yes, I want to find out. Do you think you can build like a rehab for these kind of vaping people? Do you see that in the future?
Look, I think it would be a noble idea.
Next one.
And be obvious, I think somebody to come with the idea, and I think they need some bit of rehab for it. And obviously, the most important, I think you need some psychological. So I always say that people who vape or smoke, they're kind of escaping from something, and they need something to distract them.
Why you say
Yeah, so you can't have you have to kind of they have to have psychological support, how to find something else that can drive them. I mean, what drives me is work. I love work. Maybe they must just work a lot and then they smoke less. They need to know how to cope with the stress. Any other questions?
Yeah, may I ask a question, please?
Yes.
So does vaping also cause throat and lung cancer? And can you get secondary smoking from it as well?
Yes, it does cause, because most of the flavorings, like the formaldehydes, they're known to be carcinogenic. But as I say, so there are a lot of cancers that are emerging. But if you look statistics, the 37 million people that smoke are young people. So probably in the next 10, 15 years, you're actually seeing that most of those cancers going to pop up and you're going to see a typical cancer. Yes, so they're carcinogenic. Do they cause heart problem? The answer yes. If you look at my presentation, all the common denominators in the nicotine. So the risks are very high, yes. But I think because we don't have the data. But once the data come up, it's going to be too late. That's why we want to promote that people stop already earlier.
Thank you.
Next question.
How does vaping affect diabetes?
I think I did mention that in my slides. Let me go back. The problem that because of the nicotine, of course, it's a cycle to do more with nicotines. And of course, you have, when you it's create excitement and increase your metabolic pathway. But I didn't mention that on my slides quite very nicely. Let me go back. I'll tell you now. I think on the presentations, where is it? There. So your issue, is more by the insulin resistance. So what is that? They give you insulin resistance, and then they also alter the lipid profiles. And I think this is more related to your nicotine per se. Yeah. So that's the relation for it. Yes. Are you vaping?
No, not.
Okay, great. Keep it that way.
Great.
Next question.
Morning, Doc. I'm curious if you've noticed how many patients smoke and vape at the same time.
I think a lot of people. Actually, it's a lot. Because they find that's an escape route. As I say, they smoke cigarettes and they smoke in the restricted smoke, this designated area of smoke, and then of course the vaping inside. But also it becomes like alcoholics. Alcoholics have been now. They say no, I only smoke one. It's drink one thought because that denial. So smokers become also now they deny, say now I'm vaping, it's safer. So we see that quite a lot. Yeah.
Yeah. Right.
Yes.
Yes.
We understand that in terms of pathophysiology, vaping or smoking causes mucociliary changes, but on a cellular level, how does it come about that it causes cancer? How would you break it down?
Lady, thank you. No, I think all the effects related to really for we concern about the flavoring. the flavoring, of course, when they go to your lungs, and that's what it activates your macrophage, your endothelial functions, and then you generate a lot of reactive species, and also look at the cytochromic enzymes. So it's a complex problem. And if you look again, I would probably, let me just open you the slides. I think if it looks, I think it's I'll show you now, but it's more to do with the with the fact that with the certain kind of it activates some of the genetic factors in your lungs, the AKT genes and all of them, and that's where the smoke and actually the cancer coming from.
Yeah, I think you did mention it.
Yeah, I think it's part of it. Let me see whether I could get for you that. Yeah, but there's a very direct relations. Yeah. You think?
There.
Yeah. Okay. So there you are. It's really moderated to your acetylcholine receptors on the epithelial cancer cells, activation of P13K and AKT. And then, of course, your nuclear kappa B, rich inflammatory cells that drive your proliferation and then survival of your cancers. Yeah. And then also nicotine promote angiogenesis. Remember the common denominator between the vaping and e-cigarettes is really the nicotine. And nicotine is a common driver of the malignancy of those patients.